We're just going to leave now. The music's come on, the lights have come on, and that signifies the start of this Ibogaine trip for Ruby. What if there was a pill that could cure drug addiction, depression and PTSD overnight?
It's called Ibogaine treatment. Ibogaine.
Some people claim that Ibogaine, which is a very powerful psychedelic drug, can do just that.
He was suicidal when he did it, and it completely changed his life.
Your brain can heal beyond your natural baseline.
I definitely think it's going to change the course of my future, definitely.
Ibogaine is a banned substance in the United States. It has been since the 1970s. But President Trump is now looking to fast-track its research and approval.
We know almost nothing about this medicine in a controlled laboratory environment.
The text message came back, sounds great. Do you want FDA approval? Let's do it. It was literally that quick.
But what exactly is Ibogaine? Who is taking it? And are they risking their lives in search of a magic bullet? I've come to Mexico to find out, because this stretch of coastline in Baja California is the world centre for Ibogaine therapy. Clinics here operate in a legal grey area, and I've been invited to one of them to see Ibogaine in action. What's your history with drug addiction? I find Kyle and Steve in the living room. Both have a long history of drug addiction, their lives ravaged by America's opioid epidemic. Steve is detoxing to get fentanyl out of his system before he can take Ibogaine. When was the last time that you took fentanyl?
Before I got on the plane.
Before you got on the plane to fly out here?
Yeah, I was getting dropped off by my brother, and yeah.
Wow.
Yeah.
Okay, so this is all very present.
Very present, yes, definitely.
And does it feel like it's worth the risk? Because Ibogaine is a powerful, can be a dangerous drug.
Yeah, well, I do dangerous drugs all the time, so it's definitely worth the risk for me. Yeah.
This house is part hotel, part clinic. In the kitchen, meals are prepared for the patients. In the office, capsules of one of the most powerful psychedelic drugs known to man are being weighed out. How important is it that you get exactly the right dose here?
Yeah, it's very important, because if we overdose the Ibogaine, it can affect the patient, his heart.
Ibogaine comes from the root bark of a plant native to Central Africa. It's long been used there for spiritual and religious reasons. The drug prompts vivid hallucinations and stirs memories. It's thought to restore the brain's reward system, which explains the reset feeling some people report after taking it. Up to 9 patients can be here at any one time. Most are battling drug or alcohol addiction and mental health problems. Clinics like this can charge thousands of dollars for the Ibogaine treatment. Ruby has agreed to let us film her full experience. She's a recovering addict with a history of anxiety and PTSD.
So my partner has a friend who did Ibogaine about 10 years ago, and it was really beneficial for him. He was suicidal when he did it, and it completely changed his life.
The executive order I'm signing.
President Trump's sudden interest in psychedelics came as a surprise to many.
It's called Ibogaine treatment. Ibogaine.
His executive order means Ibogaine will be fast-tracked for research and approval.
Have you done psychedelics before?
Yeah.
It paves the way for treatments like this to one day take place in the United States.
You're going to have the test dose, okay, just to check how it's working in your body.
The medical team is preparing to give Ruby her first dose of Ibogaine. The mood is set.
This is for not having any distractions.
And Ruby's phone is taken away. Patients sometimes feel compelled to drug dial while on Ibogaine.
Okay, this is your test.
Okay.
Just over the 6.
Okay.
Very important. With Ibogaine, you can feel
Final
nauseous,
guidance is
okay,
offered
and
by
you
the
can feel
doctor.
You are going to have some music and some lights, okay, to helping you going through the experience, okay?
We're just going to leave now. The music's come on, the lights have come on, and that signifies the start of this Ibogaine trip for Ruby. Downstairs, they wait to see what happens next. The medical staff here are monitoring a live stream. This is Ruby, you can see in bed. They're also watching her heart rate to make sure that she's not having any adverse reaction to the drug. Ibogaine can elongate the space between heartbeats and even cause fatal cardiac arrest. After 30 minutes, the doctors return to give Ruby her second dose.
How do you feel, Ruby?
I feel it. I do feel it. It's
What do you
very
feel?
chill. But like I definitely see a little bit of visuals and my brain's going to different places.
So you
Okay.
see visuals. You have heavy thoughts.
What?
You
Heavy
have
thoughts.
Heavy thoughts.
No,
Just the visuals?
just visions, yeah.
Shortly after, they go back to check on her again.
She's tripping at the moment. Yes, she says very intense. So if you want, we can check on her.
I feel better.
Okay.
Anxious.
Less anxious. Okay, thank God. Okay. Are you having visuals?
Yeah.
Okay. What do you see?
When I open up my eyes, like I just see patterns and flashes of light and stuff.
Okay.
Some people get really anxious.
Yes, very, very, very. That they feel that they are going to die.
Oh, really?
Yes, so we need to medicate them because they feel very uncomfortable.
That must be scary.
Yes, I think yes.
And I've heard some people say that it feels like their life is flashing before their eyes.
Yes, exactly. Yeah, like they watch a movie about their lives.
The medical staff have done their final check on the patients for the evening. They'll only come back if the patients request them to by pressing the call button, but if they don't, they will continue on this trip, this Ibogaine trip, until the morning. Ibogaine trips sometimes last up to 12 hours or longer. It's an exhausting night for everyone. It's the day after the Ibogaine treatment. They describe this as the grey day, when lots of patients feel symptoms similar to a very heavy hangover. So low mood, extremely lethargic, often not wanting to eat anything. I'm going back to the house to see how Ruby's feeling. You okay?
Yeah, I'm good. Just coming back into my body when I was feeling my heart beating as like the medicine peaked, and I could feel like the blood moving through all my capillaries and arteries. It just brought on the panic.
Mm-hmm. Mm-hmm. Who did you see?
I saw a lot of different people. I saw my ex-husband, I saw my dad, I saw my sister, I saw my mom and my boyfriend. Visions of myself as a kid and like random art and like toys from my childhood bedroom.
Are you happy that you did it? Do you feel like you're going to come away with something?
Oh yeah. With my anxiety, because it's pretty constant in my life, I feel it in my body all the time. And ever since I woke up this morning, like I don't feel it in my chest.
Really?
Like, yeah, it's weird. Like I don't feel my like heart pounding right here like I normally do. So that's pretty wild. Yeah.
That's pretty incredible.
Yeah. So we'll just see what else happens. Yeah.
Testimonies like Ruby's are helping to further the case for Ibogaine with politicians.
Everybody has problems, and most people solve them one way or another themselves.
Conservatives in America have long been staunchly anti-drugs.
Something like schizophrenia.
From Richard Nixon,
America's public enemy number one is drug abuse,
to Nancy Reagan's famous slogan,
Just say no.
But Donald Trump is now inviting advocates for psychedelics like podcast host Joe Rogan into the Oval Office.
With one dose of Ibogaine, more than 80% of people are free of that addiction. With 2 doses, it's more than 90%. I sent him that information. The text message came back, sounds great. Do you want FDA approval? Let's do it. It was literally that quick.
Brian Hubbard, who is known as the Republican Party's psychedelic whisperer, was there too. How did you persuade Donald Trump to break with tradition here?
Well, it was certainly not me by myself by any means of the imagination. With Mr. Rogan's help, he was able to reach out to the President of the United States, explain that Ibogaine is unique in its capacity to produce breakthrough therapeutic results. Whatever any person's opinions may be of President Trump as a political figure, even if you happen to be an individual who disagrees with 99.9% of what he does, every once in a while, even the greatest opponent will offer a hand of progress that everybody can agree on.
Back at the clinic, father of 3, Kyle, is having his heart screened to check he's suitable for treatment.
How old are you, Kyle?
37.
He's hoping Ibogaine will help him kick a decade-long drug habit.
I've kind of felt like this wasn't a choice for me, just because of some of the struggles that I'd had. I felt like I needed to come here.
You feel like this is your only option?
Yeah, pretty much. I would rather risk my life to get my quality of life restored again and back, there's a lot of other people out there that feel the same way, and you can't blame them.
What's up, man?
Almost 3,000 people have been treated here over a decade, most of them arriving from the US and Europe. Clinic owner Aidan managed to overcome his heroin addiction using Ibogaine 14 years ago. He's seen great success stories, but says many are being misled by claims of a magic cure. So that's different to the figures that we're hearing from Joe Rogan in the White House, who's saying 90% success.
Oh yeah, Joe Rogan's full of it. It's really unfortunate for us because we have to weed out a lot of desperate people that have been misinformed by podcasts like that, and there's several others, and even politicians who are just creating this hyperbole that this is going to be the answer to whatever issues they have in their life, which is not true at all.
Some people will listen to what you're saying and think that's unusual, that a man who owns an Ibogaine clinic is sceptical about just how successful Ibogaine is.
Well, we wouldn't be doing it if we didn't believe in it. It's definitely has its benefits. All psychedelics have their benefits, but it's just every person going into it should be well aware of the work that they need to do after, that this is not just a magic bullet where it's a one and done thing. And we just try to be as transparent as possible instead of trying to hop on the gravy train.
Some scientists who have studied the drug extensively say it's far too soon to make it legal. You think that the number of deaths from Ibogaine could well be larger than the publicly reported figures that we currently have?
Absolutely. In an unregulated black market of treatment in clandestine international locations, we know absolutely nothing about whether it's actually safe or not.
That's quite scary, isn't it, given what we're hearing from the White House at the moment about trending towards the possibility of federally, approving Ibogaine. That's quite scary.
It is quite scary for me and for a lot of people in the scientific community. In some ways, it's actually the opposite of what we saw unfold with the Controlled Substance Act back in the 70s, where they were, similarly not listening to scientists, but they were going the other direction.
I'm leaving Mexico with the scientists' warning ringing in my ears. I've seen up close how powerful Ibogaine as a drug is, and how intoxicating it is to people who are desperate for something, anything to fix their problems. For some, it heralds remarkable results, but with the lack of any long-term clinical studies into Ibogaine, there are serious, outstanding questions about its safety.